would like to ask Marc Sansom to make his presentation. He is the director of the SALUS Global Knowledge Exchange, and he is organizing now the Healthy City Design International Conference and Exhibition. So, yes, please. The floor is yours.
Good morning, everyone, and thank you very much for inviting me today. I'm very grateful for the opportunity, and apologies I was slightly late. We're extremely busy with a virtual event that we're holding in the healthcare field next week with over 200 talks and 60 sessions going on. So it's and 700 participants. So it's a busy time. So I'll just share my slides with you. Okay, so I'll just start off by giving a little bit of background about who we are. We are the SALUS Global Knowledge Exchange, and we are a sort of international global knowledge community dedicated to looking at how you design a healthier society and a more sustainable planet. So we're a global group really of researchers, practitioners, policy thinkers, who all are looking really at that intersection between human health and planetary health. And what I'll begin with is by just starting to give you an idea of the approach that we take, and then a couple of very small short case studies from some of the examples and presentations that have been given at some of our conferences over the years, and a sense really of you know, how when we're designing healthy cities, what that means in terms of the value of green space to our health and our well-being, but at that intersection with planetary health. To say our vision is to improve human and planetary health by design. We're an interdisciplinary global knowledge community. So, you know, we really work at that intersection of the gap between research, policy and practice. SALUS, of course, means health and wellness. But we've also developed it as an acronym around the core areas of our activity, which is science and technology, architecture, lifestyle, urbanism, and sustainability. So our work is really, you know, working with this global interdisciplinary knowledge community is to promote science, innovation, and facilitate linkages between research, policy, and practice. It's to advocate design as a tool for change to improve planetary health. We're focused on building a digital archive of research, built projects, and technologies, and we've published over 3,500 articles and papers over the last 5 years, and 600 examples of healthy projects, built environment projects. Our work is also to create an innovative environment for commercial and global market development in this field, and to build knowledge and skills capacity through education and training, as well as to showcase global expertise in the field of human and planetary health. Well, okay, so just to give you an idea of our approach, I quote here from the World Health Organization: health is created and lived by people within the settings of their everyday life, where they learn, work, play, and love. Health is created by caring for oneself and others, by being able to take decisions and have control over one's life circumstances, and by ensuring that society lives to create conditions that allow for the creation and attainment of health. So we have a very adaptive approach and a contextual approach, working with projects around the world, but grounded in the core principles of planetary health, health creation, promotion and protection, the concepts of salutogenic versus pathogenic perspectives, an ecosystem approach, and recognizing, of course, the importance of the Sustainable Development Goals. I'd like to talk to you a little bit about planetary health. I'm sure you're all very familiar or are becoming familiar with this concept, but it's a fairly new area of science and thinking, developed really after 2015 when the Lancet and the Rockefeller Foundation formed a commission on planetary health and published a special report called Safeguarding Human Health in the Anthropocene epoch. And this is a new scientific field of study that is really taken to the next level from public health and international health into planetary health. And for the first time really tries to understand, you know, the relationship between human health and the planet that we live on. So, you know, we can't have healthy people on a sick planet is the fundamental sort of thing to consider here. So the planetary health work recognises that humans are healthier than ever before. Life expectancy has been going up, poverty has been coming down, child mortality has been coming down. To achieve this, we've overexploited the planet, however. So, you know, carbon dioxide emissions are going up, ocean acidification, energy use, tropical forest loss, water use, fertilizer use. You can see the exponential impact on these graphs of what we're doing to the planet. So living in the Anthropocene epoch, you know, what does that mean? You know, we're living through a period of environmental changes induced by human exploitation of the planet. And that's how we're defining this new epoch, this based on evidence from atmospheric, geological, hydrologic, biospheric, and other natural system process that as human beings we are clearly now altering. So it's a little video here which I think, you know, just sums this up very well, which I'd just like to play for a couple of minutes.
This is the story of us.
I'll move on, to be honest. You know, I can send everyone the link to the video and you can watch it, you know, in your own time. There's a whole group of videos actually that help people to understand, you know, the planetary health aspects. So, but to summarize some of those things, you know, what are the drivers of these environmental changes? Unsustainable consumption, absolute wealth is the main factor for increased absolute environmental impact. Inefficient patterns of production, 30 to 50% of all food produced is wasted. 1/3 of global energy use is dissipated as waste heat. Population growth, of course, the UN projects a global population of 9.6 billion by 2050. We're looking at a comparison of a UN low of 7.4 and a high of 10.6. This could be a difference in global carbon dioxide emissions of 32%. So, you know, there's a huge impact here. Technological development has underpinned human exploitation of the environment. Even technologies that improve resource use efficiency then also stimulate consumption. And this is known as the rebound effect. Let me play again here. So, you know, just summarizing in this graph here, you know, climate change, biodiversity loss, undernutrition, water use, soil degradation. So what do we need to do to safeguard human health? We need to maintain the health of the planet. So we need to learn more about planetary health and what that means. We need to reduce food waste. We need healthier diets with a lower environmental impact, and we need better governance. We need to use water far more efficiently. We need to end deforestation. We need better family planning. And ultimately, we need better city planning. And city planning is very much at the heart of the planetary health work. And that's one of the reasons that we really use it to underpin a lot of our work around healthy city design and planning. So I'll just move on to talk to you a bit more about our approach on health creation and the concept of health creation. So we recently published a book by Lord Nigel Crisp, who was the former chief exec of the NHS in the UK, entitled Health is Made at Home, Hospitals Are for Repairs. The concept of this is that health professionals don't create our health, we do. All of us have responsibilities for our own health and the health of our families, our behaviours, our diet, our exercise, our use of tobacco and alcohol, all impact on our health and well-being. And employers, educators, architects, businesses and community leaders also have responsibility to create the conditions that allow us to lead healthier lives. The challenge is that often we equate health with healthcare, and these are two very different things. Healthcare is a service. It's an industry that is delivering and treating us. Health is something we create. Something is something that we sustain, maintain, create in our everyday lives. And it's really important to make that differentiation because it's often, confused. So we also work with the idea of health promotion, and that's also different from health creation. I think it's easy to, again, mix these things up. Health promotion is more about very specific interventions to improve the level of health in a whole population by preventing disease, controlling hazards, improving fitness and well-being through those kind of public health and health promotion interventions. We also work, of course, with primary, looking at prevention, more in more detail. What does prevention mean? It means the prevention of disease, for example, through clean water, immunization against infectious disease, the early detection of disease at a stage where it can be treated or limited, and tertiary prevention, the prevention of disability. So all of these things need to work hand in hand, but we try and focus as much as we can on the health creation, because if we invest more in the health creation end, then we can save money in the NHS or the health provision or the health systems that we all work in around the world. So this also feeds into the understanding of the salutogenic versus the pathogenic perspective. And when we talk about the pathogenic perspective, most of us probably understand that and are aware of what that means. It's much more about the treatment of disease. So it means pathogenic means the origin of disease. Salutogenic means the origin of health. So when we're looking at the pathogenic end, we're talking much more about the strengthening of health systems, including system and service design, technology and infrastructure, how we treat and care for our citizens in response to the threat of both communicable and non-communicable disease, including strengthening pandemic resilience, of course, which we're far more familiar with this year than we have been in recent decades. Whereas the salutogenic approach is really looking at the determinants of health. It's those things, those factors in our lifestyle, in our environment that help us to be healthy, to support us to develop our health and improve our health in the things that we do every day. So, walking to school, walking to work, cycling, exercise, nutrition, social connection. These are critical things that help us to improve our health and then fend off disease. So it's disease and health are really on a spectrum, and as you move along that spectrum, no one is at one particular end of that spectrum. We tend to all be at one point of that where we might have an element of disease and an element of health, and we're trying to always move towards the right, towards that ultimate goal of total health and avoid death. Now, I was on a webinar last week with Lord Crisp, and we had Samura Gray talking about how actually we start to age from about 40, but it's really our level of fitness that will keep us healthy. So we're gonna be impacted by disease at some point, but fitness is what enables us to remain healthy as we get older, and we should remain in good health, or can remain in good health well into our 80s if we can avoid disease and other disabilities. So our approach, as we move closer to understanding what planetary health, what health creation, what salutogenies means in terms of healthy cities, this gives you a representation of what we think about when we're looking at what a healthy and sustainable community really means. So all of these elements from urban design and planning, arts, sports, energy, industry, science, education, schools, public health, agriculture, transport, mixed use, and of course, very pertinent to you, public realm, green infrastructure, nature and parks. All of these things are part of an ecosystem. And we can't look at any one of these things in isolation. We need to understand how they all interact together. So our approach is always to look at, where the ecosystems and where do they connect to each other. So, I just brought in a few slides that were perhaps particularly relevant, and we've been lucky enough to have many people talk at our conferences over the years about the value of nature, how nature impacts on our health and our well-being, how green spaces, can support, socialization, as well as that kind of biological and physiological processes that improve our health. The World Health Organization said in 2017 that green spaces and other nature-based solutions offer innovative approaches to increase the quality of urban settings, enhance local resilience, and promote sustainable lifestyles. Now, this is, we feel nature and green spaces is critical. It's where we come from. It's how we feel more connected in those spaces. So what the World Health Organization reported in this document was that urban residents need to have adequate opportunities for exposure to nature. Urban biodiversity needs to be maintained and protected. Environmental hazards such as air pollution and noise need to be reduced. Impacts of extreme weather events, are mitigated by nature. The quality of urban living is enhanced, and the health and well-being of residents is improved. But we need to be clear when we're planning cities and communities, what our objectives are for green space planning. We need to have a longer term perspective on it and always remain flexible. And we need to make use of the urban local planning context and frameworks. Consider green space projects to be a public health and a social investment. We need to put green space close to people. Consider simple design features to improve the comfort of those using urban green space, and plan for a diversity of urban green space types, responding to different demands. And there's plenty of research to recognise that actually different cultures, different ethnicities respond to green spaces in very different ways. So there's no one size fits all either. We have to think about what works for everyone and not for one particular group. So here's an example that was presented, a very small, micro example, I'd say, but a very interesting one with very interesting results, based in North London. Fixed Park consists of a modular design of planters and benches arranged on a former loading blow, just providing an informal seating area. But you can see here that the outcomes from this small project over 6 months was a 41% increase in self-reported well-being, 23% increase in users dwelling in the street, helping foster community interaction and providing economic benefits to local businesses. Colonisation of wildlife, supporting climate change, adaptation, increasing biodiversity. These are all such valuable things by a very, very small kind of intervention. And we've been lucky enough to publish many examples of this over many years and hear many people talking about these kind of examples at our conferences. So the implications, green spaces can be integrated into our cities in quite exciting and innovative ways, and they don't have to be big scale. They can be small scale and have a big impact. The second example, which is a favourite of mine because I visited Kutepot Hospital on many occasions right from the beginning of construction, and it's one of the most beautiful hospitals I've ever seen. It's stunning in the way that it interacts with nature, and I just wanted to present this for you, not as a city example, but what you can do in a hospital. So the Kutepot opened in 2010, but from its inception, its project set out from the very beginning to explore how architecture can positively impact health and well-being. So site, visual access to greenery and watering gardens that appear rainforest-like, smell, selection of scented plants, sound, falling water, variety, selection of plants that attract birds, butterflies, insects. They have a full butterfly garden here at the hospital. They're also set next to a lake, and the lake takes off the wind off the lake and pulls it through the building to also have an impact on air quality and access to fresh air, as well as cooling the building in the hot climate you get in Singapore. So, this was a winning scheme, that was built and has been, I think I haven't been back for a few years, but I'd imagine now the landscape is just growing up beautifully from within the building. we did publish and we had a talk presented at our conference a couple of years ago following a post-occupancy evaluation looking at how natural elements, water, greenery, biodiversity affect user perception at the hospital and how these perceptions have impacted on patient and family preferences and well-being. And it was very clear that patients, staff and visitors had a perceived sense of better well-being from the natural environment of the landscape of the hospital. So that's my sort of second example. So I'm just going to finish off just by concluding, just telling you a little bit about our conferences. Our one next week, which is being held virtually for the first time, is European Healthcare Design. This is much more about health systems and infrastructure, but the healthcare industry has a major global climate footprint worldwide. It's now the biggest industry in the world, so it has a real duty and responsibility to promote planetary health. And we play a big role in trying to support the healthcare industry in building in their sustainable development approaches. Example of our program committee. But the event that I think perhaps would interest everyone here most is our Healthy City Design event, which is being rescheduled now for late November due to the impact on our schedules of the pandemic. The focus this year is designing resilient communities, recovery, renewal and renaissance. The call for papers was launched after the pandemic. So we have over 120 submissions that will be launched in a few weeks as a program. As I say, probably held late November over 3 or 4 days. Much of the work is looking at the impact of COVID on our cities and how we're going to plan and design those cities in the future. An example of our program committee, many fantastic people, researchers, policies and practitioners from all over the world, from the Planetary Health Commission, from some of the leading universities, Bloomberg and others all over the world. This was a video, so I don't know if I can make it work. If we can't hear it, then I'll send a link.
We're trying to build a community around healthy cities. It's an interdisciplinary community, and we want more people to join us.
I came to this conference to learn as much as I could about how design and health go together. I've enjoyed meeting people who are in the same field as myself, trying to build better environments that help communities be healthier and happier.
This year, the quality of the papers and the presentation is a step change from last year, and that it's stimulating some really interesting discussions, both in the sessions and then in the corridors and sort of networking.
The Healthy Cities Design Conference is incredibly valuable to our business because we are constantly looking to engage with the next thought leaders in the area of healthy cities design and healthy buildings, and they're all here.
I've really enjoyed the opportunity to talk to lots of different people from different backgrounds and different silos, so that generating cost-cutting conversations. And I think that's an opportunity we don't get that often in the professional world.
A focus on some really topical issues around active travel and around external air quality, and a lot of people really trying to push an agenda that speaks to government and lobbies governments to make some real tangible change in the community.
It's a fantastic opportunity to talk to your contemporaries and also make contact with other people and talk to scientists who are really fascinating.
Really exciting talks on creativity and the health benefits of that, and things happening on the ground in terms of tactical urbanism. So I've heard lots of different snippets of things in practice or research that have been super fascinating. And of course, I'm completely enjoying talking to people. It's opportunities to not only hear and learn from people, but also potentially starting working towards better visions of healthy cities in the future.
I most enjoy the keynote speakers. I realize these are the folks that have really achieved greatness. They've been carefully selected for the quality of their messaging, the social engagement. I've made a lot of new acquaintances so that I can continue my work and know that I'm working with the people who are at the cutting edge of the science and the art of changing cities to make them healthier places.
This is really the best place where research, practitioners, students, and policymakers come together to talk about healthy city design.
What I've enjoyed most about this year has been our keynote speakers. Marc Sansom of Civitas in the USA really gave us some wonderful case studies on how urban design intervention and founding principles about health can make healthier environments.
I've enjoyed meeting people who are in the same field as myself, trying to build better environments that help communities be healthier and happier.
I came here today and yesterday because of the lineup of the speakers. It's been fantastic. My top tip is to have a look at the program before you arrive. There's a lot going on, so you need to plan your route between the sessions.
Certainly been a full-on couple of days, and it's all been really good and good high-quality discussions. Really brought together for me some of the issues about what we can do quickly, as well as some of the longer term things that we need to consider in terms of infrastructure and services.
People should really put Healthy City Design 2020 on their calendar, because this is the place where you're going to get the newest ideas, the best practice, and the most advanced research.
If you're not here now, you belong here. This is a great place.
Okay, thank you very much. As I say, we will be rescheduling the Congress until late November and launching those new dates in the programme in a couple of weeks' time. But yeah, I'm very grateful for the opportunity and thank you very much.